It's visible, sir. Sorry, sir.
Yes, I'm ready, Chandu. Know when to start.
Okay, sir. Um, so before we start, I will give you an introduction. So give me 1 minute. I'll just check if everyone's. Yes, sir. So right now, and I will begin with giving you an introduction because it's very much needed today, even though you are so established. So I will just begin with that. Dr. Ashith B. Acharya is an Australia-trained forensic odontologist who completed his bachelor's degree in dentistry in 1999 and his post-graduation in 2001, and heads India's first exclusive department of forensic odontology in SDM College of Dental Sciences, Dharwad, Canada. Karnataka. I'm so sorry, Karnataka. With over 17 years of experience, he teaches undergraduate and postgraduate students and serves as a consultant in forensic dental, anthropological, and archaeological cases. As referred by the police, government agencies, and forensic medical experts from across India, including the Nirbhaya case. He is a founder member of the Indian Association of Forensic Odontology and currently its secretary. He is an editorial board member reviewer in several national and international journals. He has served as a member of International Organization of the Forensic Odontostomatology Age Estimation Work Group and is currently on its bite marks work group. He has published 43 journals, 34 of which have appeared in the top international forensic and dental journals. He has also contributed to government reports and chapters on forensic odontology in eminent textbooks such as R. Schaefer's of Oral Pathology. I'm very sorry I stuttered in the beginning, but over to you, sir.
Thank you very much, Chanchal. Years of experience, it's not uncommon to stutter, so I don't think you should be very harsh on yourself. At the outset, thank you so much for inviting me to make this presentation and I'm so happy that you thought of letting me present on a topic which is not just unusual because it's related to forensic dentistry, but I think what makes it even more unique is because it's talking about something related to translational research. So, this presentation over the next 45 minutes or so is going to talk about translational research in forensic odontology. First and foremost, I'm introduced as someone who's working in Dharwad. And just for your information, that's exactly where Dharwad is. It's midway, the exact midpoint between Bangalore and Pune. It's a lovely little twin city. Its twin sister is Hubli. And right here, since the past 35 years, we have a wonderful institution called SDM College of Dental Sciences. And this is where I graduated from 21 years ago. And this is where I've been working now for the past 15 years. And this is exactly where we've had India's first exclusive forensic odontology department. Now, ours is a private institution, but about 10 years ago, we were recognized by the Karnataka government as a state referral center for forensic odontological cases. And that allows the police to refer cases to us, and we get cases from all over India, be it police cases or even cases from other government agencies such as archaeology and anthropology departments. Now, is pathology. It's the branch of dentistry which deals with the law. So that's as a simplistic a definition that I can give you. Of course, there is a definition which I'm not going to go into right now. So for the moment, you can just keep in mind that any area within dentistry that looks at legal ramifications, that's forensic odontology. We can also refer to it as forensic dentistry. Both these terms are interchangeable. What are the major applications of forensic odontology in India? Well, surprise, there are many sub areas and specialties within forensic dentistry. And one of the most common that is used in India is referred to as age estimation. And this age estimation, that is trying to assess how old a person is, can be undertaken either in living individuals or in dead subjects. Apart from this, there is something called as identification. So, identification by and large is related to dead individuals, but very rarely identification may be required in living individuals also. Apart from this, dental injuries and disability claims is also something which is commonly under the Indian context, as are bite mark investigations. So it's not uncommon to have bite mark investigations referred by the police, particularly in relation to sex crimes. And last but not the least, we have something called as post-mortem sex assessment, and that's usually done in skeletal remains. This last bit is something which was not really done by forensic dentists very commonly around the world, but I've tried to develop here in India because I believe it has a lot of important applications and implications also. Of research. Basically, it involves the application of research and its findings from the laboratory to patient well-being, as well as trying to positively impacting the community. Now, research is done not just for the sake of doing research and publish in some hi-fi journal. The ultimate objective is that the research that you undertake can be used in the field, can be used in day to day work and our day to day lives. That's the purpose of research. So, when this research comes from the lab desk into our day to day lives, that's what's translational research. Now, when it comes to forensic odontology, we have an opportunity because we are in a position to try to integrate various stages of translational research into one single project. And this single project may be related to a case or any such similar application. So, therefore, let me bring to you some of my experiences as far as research is concerned and how that research has translated into real life cases. So, if you are asking how is this translational research undertaken, let's try to see it through. Now, example number one. Now, I'll be talking about certain researches that I've undertaken and what were the outcomes of these research and what were the types of cases in which these research findings were ultimately applied and utilized. Let's begin with remember the important area of forensic dentistry, sex assessment or sex prediction. Now, I mentioned that sex assessment is something that can be done in skeletal remains. So, skull, and we have no idea as to who that individual is. And the police are desperately trying to determine whether it's a male or female, because based on that, they'll be able to identify the dead person. And only when you can identify the dead person can you try to identify the murderer. So it's extremely important to try to identify human remains, skeletal remains. And one important cog in the wheel of sex of I'm sorry of identifying skeletal remains is to determine the sex of those skulls and bones. Now, about years ago, here in Harvard, we started undertaking a research, a very simple research really, where we started looking at the measurements of mesiodistal and buccolingual dimensions. And these dimensions were obtained using something called as a digital caliper. And we made use of about 50 males and 50 females. So it totaled about 105 dentitions. And these dentitions belong to relatively young individuals, not less than 19 years of age and not more than 32 years. So that was so that the teeth are relatively unworn or not really attreated. Now, having obtained these mesiodistal and buccolingual dimensions, we subjected these measurements to what was then a very new statistical method called logistic regression analysis. Now, once this logistic regression analysis, we found that surprisingly, the dental measurements were able to predict sex to an accuracy of 100%. That means virtually every case, we were able to correctly say whether the dentition belonged to a male or a female. Now, normally the teeth are able to predict sex only to an accuracy of about 75%. So, this 100% was really unusual and quite remarkable too. And all these findings were in a called the International Journal of Legal Medicine. And when I publish my research, it's usually in such forensic journals, very rare in dental journals. And forensic journals include not just forensic odontology, but it also includes research related to forensic anthropology, forensic medicine, forensic entomology, ballistics, etc. So it's these types of forensic journals that you can get most of the relevant forensic research, and that's where our sex determination study was also published. Now, having remember, I mentioned that this isn't the end object of undertaking a research. We need to finally apply it in real life cases. So, what was the real life case that we got? Well, I'll come to that shortly. But the benefits of this research was that it was new, a radically different statistical analysis, and it was the very first time that logistic regression analysis was used in forensic odontology. And as I mentioned, it had very high accuracy of up to 100%. Logistics gives us something called as a probability rate. That means it gives us a percentage as to whether the skull belongs to a male or female. These are some of the advantages. And ultimately, the research created a database of dental measurements. And this became very useful for us in developing customized formulas in various cases, because the cases that we get, as I'll be showing you shortly, we may have certain teeth missing, a few teeth present. And we may have to develop formulas for predicting the sex using only those teeth which are present in the skull and skeletal remains. So therefore, we end up creating something called as a customized formula for each and every skull that is brought to us for examination. So all of this ultimately came into fruition in a real life case. And this real life something called as the Annigiri case. Annigiri, as you see the name of that tiny little village very close to Hubli, Dharwad, where about 600 skulls were recovered. And there were very few clues which were available as to where these skulls came from. So everyone was really completely stunned as to how such skulls and bones could be recovered. And there were a lot of theories that were going around. Some said that it could be the remains of soldiers who were killed in certain historical wars. Some said that it could be a genocide by invading armies. Others believed that it could be the remains of humans who were sacrificed a few hundred years ago, because human sacrifice was quite prevalent in this region of Karnataka. But there were more sober theories, and many believed that it could just be that these were victims of a natural disaster such as a famine. So, to try to dispel or prove these theories, we were approached by the deputy commissioner as well as the state archaeology director, who requested us through this letter to test the sex of the skulls, the age of the skulls, as well as whether there were any maxillofacial injury pattern. Of course, I won't be talking about the age estimation and injury pattern here. I'll just focus on the sex assessment bit. And although there were more than 600 skeletal remains, the nature of things it is so fragile that we could only examine about 5% of them. And the way the skulls were buried with the teeth and oil, it just did not make it possible for us to remove the skulls and examine the teeth. So we just confined ourselves to examining about 30 skulls. Couple of specimens here. So here, specimen number one, we could only assess one tooth. What you see on the left-hand side, we've got 3.6 and 3.8. The 3.8 cannot be measured because we don't use it for sex prediction. Was used, and using 3.6, we were able to say that there's a 61% chance, 61% probability that the individual is male. But then it was not just the teeth that we made use of. We also made use of certain other research which looked at the mandible. And there's something called as the ramus flexure. Ramus flexure is a kind of a sharp angle that's created at the level of the occlusion on the mandibular ramus. So this flexure was missing. And if it's present, we usually consider it as a male. And if it is missing, we usually consider it as a female. So since the flexure was absent, we believe that since the flexure is more accurate in determining sex than teeth, we gave more weight to it. And therefore, our conclusion was that this mandible belongs to a female. Now, let's look at the other, because here we have just one tooth that could be used for sex prediction. We have 12 tooth dimensions, and measuring all these 12 tooth dimensions, we were able to say that there's an 83% chance that this skull belongs to a female. So we were able to undertake a sex assessment of all the different skulls, and then what we found was that 13 of the specimens we thought belonged to males, 9 of the specimens we thought belonged to females, and there were 9 which we could not conclude as to whether they belong to a male or female. Of course, there were also age estimation and injury pattern assessment. But like I said, I'm just going to focus on the sex assessment. Now, remember, the one of the theories was that these are remains of soldiers who were killed in war. Now, because we have found that it's a mixture of males and females, that tells us that it's unlikely to be so. It's a much more heterogeneous population. And as you'll see in the age estimation results, we also found that there were children there. So it looks like an entire village was wiped out for some reason. And what was the reason? Carbon dating found that these were specimens which were about 200, 220 years old. And there were no known wars at that time because the British had taken over. So finally, when they looked at a variety of records, they found records in the Gazette, which talked about a famine here in the northern part of Karnataka. And so finally, it was concluded that these were remains of people who unfortunately died in that famine. And that famine was dated back to 1790. And of course, our finding of not just age estimate, sex prediction was highlighted in the papers to show that this was a heterogeneous population. So you see, the research that we did, wherein we try to determine male-female differences in the teeth, ultimately assisted in determining whether this particular sample comprised of males or females or both. So this is one example. Let me now take you to a second example, and this relates to age estimation. Now, age estimation can be taken either from developmental changes in the teeth or structural changes in the teeth. It can be done using intact teeth, tooth sections, or even radiography. Now, about 14, 15 years ago, we undertook research here wherein I assessed the permanent tooth calcification on the lower left hand side of the jaw. And I made use of a standard method called as the Demirjian method. And I looked at more than 540 who were by and large youngsters, not more than 25 years of age. And all of these were obtained from the records of my institution here. And once again, statistics plays a very important role. So there's something called as regression analysis. So we made use of something called as curvilinear regression models. So basically, it's a type of a regression analysis, and using this, we were able to develop certain robust formulas for age estimation. Research was published in a journal, an American-based journal called as Journal of Forensic Sciences. So the benefits of this research was that it's an important finding that foreign formula, that is Demirjian's original formulas, may not be really useful in age estimation in Indians, and therefore we need to develop India-specific formulas for age prediction in this country. And once again, we were able to create a database of tooth development, and this database of tooth calcification and tooth mineralization is very useful in developing customized formulas in a variety of cases. Because sometimes we may get a child for age estimation and some of the teeth may be missing. So the formula can be developed in such a way that the missing teeth are excluded and only those teeth that are present in the mouth are considered for age estimation. Let me now show you an example of how this particular research was applied. So here's a case which was referred to us by the police here in Dharwad. And in this particular case, the police wanted to know whether the age of a female subject was less than or more than 18 years of age. And the reason for the police's question was because they suspected someone had kidnapped this female and there was forceful marriage and she was a minor. So, marriage of females less than 18 years is against the law. So, therefore, they wanted to know what was her age to determine if she was a minor. And what made things even more important for this in she was now the mother of a infant. So the police could also file cases related to rape against the individuals who were involved. Even though she may have been married, the fact that she is a minor means that there would be a technical rape involved. So what we did is, following a detailed clinical examination, we obtained an OPG of this female and we assessed the OPG in a very detailed and thorough manner. And following that, we applied that. So the emergence method makes use of this particular chart, which reflects the way teeth develop from a very young age till we are about 22, 23 years of age. And if you look at this diagram, you are, I'm sure, able to appreciate that the tooth development of different classes of teeth is categorized. So we have tooth development of molars, premolars, canines, and incisors listed separately. So here, once again, we made use of an India-specific formula, and we made use of a customized formula simply because this female subject did not have the third molar. So because the third molar was missing, we had to make use of a totally new customized formula. Our findings showed that this female was approximately 15.9 years of age, 88% chance that she is actually less than 18 years old. That means the police can conclude that the subject is a minor or a juvenile. So our findings in this case was useful to the police in under following sections of Indian law. IPC section 376 with a female who is less than 16 years of age, even with her consent, constitutes rape. IPC section 366A, which says of a female who is less than 18 years can incur a 10-year imprisonment because it can be construed as procurement of that female for illicit sexual relations or prostitution. And of course, the Child Marriage Prohibition Act of 2006 says that female who's less than 18 years cannot be married. So the legally permissible age of marriage is equal to or greater than 18 years of age. So all these sections of the law can be and were by the police to file charges against the accused in this particular case. Let me wrap up this presentation by showing you one final case, and this relates to adult age estimation. So we've looked at sex assessment, we've looked at age estimation in young individuals. Now let's look at age estimation in adults. Let me take you back to a research which some of my students and colleagues did here way back in 2008. And this is a radiographic method. It's called as the pulp to tooth area ratio. And we made use of about 140 RVGs, that is digital IOPs. And we carefully measured the tooth area as well as the pulp and root canal area using certain software applications. And we were able to develop certain formulas for age estimation. In addition to this radiographic method, a colleague of mine and I also looked at certain morphological methods such as attrition and gingival level attachment on a separate sample of extracted teeth. So both these radiographic studies as well as the morphologic study were reading forensic journals. So now the formulas and the methods that we have published in these journal articles, we were able to meet in an upcoming case. Now, the benefit of this research is that it showed that age estimation in Indian adults need not necessarily be very accurate. It can actually result in a slightly higher error rate. And once again, it told us that India specific formulas are extremely important for use here in this country. So, the case which I'll be talking about as far as adult age estimation is concerned related to a murder of a male subject. Very close to Dharwad, there's another place called Gulbarga. Today we refer to Gulbarga as Kalburgi. So here have recovered a dead body. It's a male's body, and near this dead body, they've recovered 5 teeth which are avulsed. So the police have packed these teeth and they have sent it to us for investigation. And you notice the envelope which is present here on the top left hand side, it's all sealed and it contains the details of the case, the IPC sections under which the case has been filed, and of course the signature and seal of the investigating police officer. So when this evidence is brought to us, there's a letter also that's handed to us, and I will go through the letter, check what the police require me to do, ensure that the packet is sealed, and in the presence of the police, break open the seal, and I will remove the evidence. So when I removed the evidence, you could see 5 teeth as described in the letter, but one of the teeth is fractured. Of course, the police, you can't expect them to know whether the tooth is fractured or not. So they are not really experts in that area. Now, the police are asking me, are these human teeth? And if so, what is the age of of that individual from which the teeth were recovered? These are, of course, human teeth. Sounds like a silly question, but it isn't. The police want to make sure that these are indeed human teeth, and therefore I contrast it with animal teeth, try to differentiate how human teeth look versus animal teeth, mention that in my report, and then proceed with my age estimation analysis. Age estimation analysis is concerned, my colleagues and I have taken radiographs of these teeth. And remember, I talked about the pulp to tooth area ratio method, wherein using a software app, we've been able to measure the tooth area so that method was applied here. And in addition to that radiographic method, morphological methods. So we've looked at the amount of attrition on the tooth. We've also looked at the gingival recession level. Even though the teeth are avulsed, on the roots, we may be able to see just a little bit of outline which indicates the level of the gingiva before the teeth were distance from that line till the CEJ, and that gives us an idea about the age. So all our findings are put into a detailed report. So what you see on the right hand side is the last page of that report, which contains the conclusion as well as mine and my colleagues' signatures. And our conclusion is listed on the left hand side here, that the teeth are indeed human, that the teeth correspond to FDI tooth numbers 1321, 2231, and 43. Morphological method says that these teeth belong to a person who's almost 40 years. But the radiographic method says that the teeth belong to a person who's about 32 and a half years. So what do we go with? Morphological age or the radiographic age? Because the radiographic age estimate had a lower error rate, we took the decision that it would be better to consider this radiographic age over the morphologic age. And therefore, in my final conclusion, I said that most likely this individual was 32 and a half years of age. And later, after reading my report, the police called me and said, Doc, we actually thought that this was a 34-year-old person. Thank you. What conclusion you've given us corresponds with our suspicion. So you see, the police did not tell me beforehand how old that person was. So they waited patiently for me to report and only then tally it with their own suspicions and then inform me. So that's the right way to do things. So this more concludes my presentation. So to summarize, I believe that research is vital for the evolution of the dental profession and of course the human race itself. It's thanks to research and development that we'll all be getting a COVID vaccine. Well, we've already got some, and I'm sure we'll be getting many more from different companies. So research is at the core of this. And the judicious application of research findings makes our day to day work much easier. And in the forensic context, it makes it much more acceptable to the judicial system. Cases done with the assistance of research allows for the judges to make a much more objective decision in their judgments. So I thank you all for your patient hearing. To the Rotary Club of the Caduceus Mumbai, as well as all the organizers involved in the Webodontia. Thank you so much. And if you have any questions, you're most welcome to note down my email address, which is at the bottom of the screen. It's ashithacharya.com. So just drop me an email and I'll do my best to respond to your queries related to forensic odontology. Thank
So, can I ask you a few questions right now?
Sure, sure, absolutely. If you have the time, I have. So please go
Okay.
ahead.
Yes, sir. Um, Anusri Basu has asked that she's doing a research on sexual dimorphism with the help of mandibular canine index. So
Mhm.
she wanted that can we take measurements directly on the patients instead of taking it on the cast?
And the name of the person who asked the question?
Anusri Basu.
Three. Okay. Now, study, if I'm not mistaken, done by a couple of authors called and Rose many decades ago, and I think they found that as far as anterior tooth measurements are concerned, especially mesiodistal dimensions, you can obtain it clinically in the patient's mouth, and you don't really need to rely on casts. So, to answer that part of the question, yes, you could, as long as you're very to ensure that no part of the caliper hurts the patient. I think you can guardedly obtain the intercanine dimension in the patient's mouth. Um, so yes, I should answer the question. Chanchal, are you there? I can't hear you.
Hello, sir. I'm Pranjali Joshi. I think Chanchal has a few network issues.
Okay, tell me.
Is it okay if I moderate the rest of the questions for you
Sure.
until she's back? Yes, sir. So the next question is, how far, it's by Sahiti Chaudhary, how
Right.
far a dental student is preferred for forensic research when many other methods are available nowadays that usually prefer a medical student?
Sorry, could you repeat the question? How
Yeah, yes, sir. Yeah.
student preferred? I didn't get that part.
Yes, sir. How far a dental student is preferred for forensic research when many other courses usually prefer medical students?
Okay. Did you say the name of the person is Sahiti?
Sahiti Chaudhary.
Okay, Sahiti, great question. And let me tell you that there is better skilled, better knowledgeable, and better prepared to undertake forensic dental research than a dentist. There's nobody else who can undertake forensic dental research better than a dentist. So I can't speak for other types of forensic researches, but as far as forensic odontological research is concerned, dentists are the ones who are most capable of. So no one can occupy and no one must occupy in there. And if anyone tries to occupy your position, tell him or her that more qualified than person to undertake that particular research. Full stop.
Okay, sir, noted. So there are multiple questions. So is it okay
Yeah,
if I
sure.
ask you
Again,
the
as long as
questions?
you have the
Yes, sir.
time, no problem.
Yes, sir, yes, sir. So, question by Alicia Joykutti. A forensic odontologist team was also present at the Calicut Air India air crash. Can you please elaborate the work done by you over there?
I wasn't involved in the Kozhikode plane crash which occurred just a few months ago. But my colleague from Mumbai, Dr. Hemlata Pandey, along with some of other team members, I think were invited there. She told me in a recent meeting which we both attended on that. But I also remember her saying that there were other international dentists, a team of international dentists were also there working on certain areas. So as far as I was concerned, no, I wasn't involved, but I am aware that there were other dentists both from India as well as abroad who were involved in this.
Okay, sir. And there are many questions about how to pursue a career in forensic odontology. So, if you could just clear that up, because there are no professional MDS courses
Right.
available.
Actually, what I could do is I could direct them to a recent interview which I gave to a very senior oral pathologist, and in that interview, I've enumerated, how we could pursue forensic dentistry. Now, I'm planning to put a link of that video on my website. So my website is ashithacharya.com. So probably in the next couple of days, I'll upload the link there. But briefly, I'll just say that you have options of pursuing forensic odontology studies in India also. There are full-time courses and part-time courses, and I believe one should pursue both. If you don't have an MDS, if you're not planning to do MDS, then you can pursue full-time and part-time courses in forensic odontology because they all bring you a lot of knowledge and skills. And with that, you could go forward and probably even get a job opening in any one of the dental colleges or government institutes. I know for a fact that many people who either gained training from abroad or training from India have managed to get job openings all around India. So yes, the right way to go about it would be, if not go abroad, within India, full-time and part-time courses. Now, part-time courses are, like I said, I'll direct everyone to the link which currently is on LinkedIn. Is the one who conducted that interview with. And like I said, I'll put in a link of that interview to my website. So students should certainly visit my website maybe in a couple of days and have a look. If not, you are also welcome to send me the address. I'm happy to reply as to what are the educational, what are the job prospects, all those things. Also.
Okay, sir. Thank you so much. So there is one more question by Dr. Vaishnavi. Am I audible, sir? Yes. So it says, is it better to research on a completely different and new topic in forensic odontology, or is it all right to develop on an area which has specific formulas for various methods in India?
So actually, you're not audible.
Sir, I'm afraid your voice is cracking a lot. Uh, could you please check the network?
Hello, can you hear me now?
Yes, sir.
Yes, sir.
Okay, fabulous. So I was saying that's a great question by Vaishnavi. And what I was saying is um, the novelty of a research is not that it should be on a new topic or something unusual, but what's really important is that the results we get in a research, how do we interpret them? So, how are we in a position to interpret it properly and find out if there's something new in those results? So, you can take the simplest of topics, topics such as those related to dental anatomy. And remember, sex prediction from teeth, which I've been talking about the last 45 minutes, actually relates to dental anatomy. People have been researching on sex determination from teeth for decades 50, 60, 70. Still, about 10 years ago, when I started doing this research, simplest of researchers, the results that I got, I knew how to interpret those results because I knew the statistical aspects of it. So, thanks to the statistics, thanks to how to interpret the statistics, I was able to interpret the results of the research properly. And that allowed me to find something new, something different in those research areas. So Vaishnavi, I believe you can undertake a research which probably 100 others have undertaken, but just be open to finding something new from the results that you get. And how do you find something new, something different? Well, sometimes you may not get anything new, but if you do get something new, only if you know how to interpret the statistics will you be in a position to identify that there's something new and different. So that's my piece of advice here.
So, one last question.
Sure.
Isha Verma has asked, Doc, what got you interested in forensic odontology, and could you give us some tips for aspiring candidates?
Um, you know, I've mentioned this to a few people before. When I finished my BDS, I was not sure what I wanted to do, but I was sure what I did not want. I was sure I did not want clinical dentistry. I was actually interested in community dentistry, public health dentistry, but there were not a lot of colleges which offered MDS in public health dentistry at that time. So I just started looking at different options, and I was always interested in anthropology. And I noticed that forensic dentistry was very different, and it also had aspects related to anthropology. I started doing more and more research into what it is, found it very interesting, and went ahead. And to all of you aspiring and budding dentists, I'll just say make sure that you work hard, be very disciplined, be patient. Uh, don't think that you'll get what you want very quickly. If you do, excellent, but always be patient. And make sure you are clear about what you want and what you don't want. And sometimes it just helps to take some time off because when you're say 22, 23, 24 years old, you're likely to be confused. There may be so many people telling you so many things, so it may be quite a difficult thing to decide as to what needs to be done. So just relax, take some time, measure all options, or rather weigh all your options, uh, listen to your parents. Ultimately, they have your interest, your at heart. So always make sure you also listen to elders and their advice, and then just take your own decision.
Okay, sir. Thank you so much. It's actually very wonderful advice. And there is another question.
Sure.
If so, the first question that I wanted to ask is, why did you use 3-6 for sex determination and not 3-8?
Okay. Good question. I did not mention it in that presentation. I just said that 3-8 is not used in sex determination because third molars are highly variable in their morphology. And that's one reason third molars are almost never used in forensic dentistry. I think one of the few areas we use third molars is in age estimation of developing dentitions. When we want to determine whether a person is less than 18 years or more than 18 years, that's when third molars are used. But when it comes to sex prediction of skeletal remains, because we have so many other teeth also available, and since the third molar is quite variable in its morphology, we exclude it. So even while undertaking a research, we just don't measure the third molar, mesiodistal, and buccolingual dimension. We totally ignore it. That's why. So that's why 3-6 was used and not 3-8.
Okay. And 3 people have asked about the Nirbhaya case, what techniques you used, and how big a role did forensic odontology play?
Okay, the technique we used is a fairly standard procedure called as two-dimensional digital bite mark analysis. So this involves taking the photos of the bite marks, which of course was taken in Delhi itself. It was taken in Safdarjung Hospital and in All India Institute of Medical Sciences, although I did guide them as to how the photos have to be taken. Once these photos were brought to us, we scanned them using your normal scanner, and we opened it using Photoshop software. The casts of the accused individuals were also sent to us from Delhi to Dharwad. So in Dharwad, I scanned those casts also. And how do we scan it? The incisal surface of the casts are to be in contact with the scanner glass. So that's how the scanning is done. So we basically are able to see the teeth in the scanned images. And then there are certain procedures wherein we are able to draw the outlines of the incisal surfaces on the casts. And these incisal surfaces, we superimpose them. That is, we lay it over the bite marks to determine if there's a match or not. As far as, of course, all this analysis was done on the computer itself, and that's the, as I mentioned, a standard way to do it. As far as how much of an important role did forensic dentistry play, I think and I like to believe that all the forensic analysis used had an equal role to play. Perhaps DNA had a slightly more important role to play. But I think all the forensic analysis, be it fingerprints or forensic dentistry or DNA, had very important roles to play. So I won't really say one was much more important than the other. Maybe DNA was first among equals. But yes, forensic dentistry also had a very important and very useful role to play. Now, I just want to add one more point here. In any case, it's important when you're trying to get a watertight case against an accused person, we have to make use of as much of evidence as possible. So you can't just say that I've got fingerprints here, so I won't use teeth. I've got DNA here, so I won't use fingerprints. In my opinion, that would be rather foolish to do. So make sure that all types of forensic evidence is used to ensure that the case is watertight against the accused. So that's what was done in the Nirbhaya case.
Okay, sir. So I think with this we come to the end. Okay, 1 second. Someone has.
One more question.
Yes, just. She really wants to ask. I'm looking for it. Give me 1 second. Is it from the Demergence method that makes you estimate the age of the victims exactly?
We can't determine the age exactly. Remember, that's why the term used is age estimate. We call it as a scientific approximation. So it's never exact. Many of the cases we end up getting exact age estimates. But having said that, we don't expect to get an exact age estimate because by nature we refer to it as age estimate. So we agree that it's a scientific approximate. So the emergence method has its advantages, and because it's a method which is used in developing dentitions, you can get age prediction which is very close to the real age. In adults, that's not the case. The age estimates become more and more, or should I say, less and less accurate in adults. It's usually slightly more accurate in children and adolescents. So let me put it that way.
Okay, so I remember that you said that it was 98% correct. So I get it. You exact.
So it's highly unlikely we make 100% probability.
Okay. So with this, I think we come to the end of the session finally. I am very you actually were so patient and answered every question, which is really great. Also, during the session in the beginning, my friend messaged me saying that I have never seen such a calm teacher. Like, we've had, I think this is the sixth session in the week, and they're all very, in awe of you, because now that we're finally, interacting with you, for us, since you are literally the pioneer of odontology in India. So thank you very much, sir, for today's session. It
Thank you,
really
Simran. Thank you for your such kind words, such thoughtful words. I really enjoyed this presentation. Um, I hope all of you, you and your friends, have got some useful information from this presentation as well as the Q&A. And like I said, any additional questions you have, you're most welcome to just connect with me via email. I'm usually pretty prompt with my email responses. Even if I don't get back to you in 1 or 2 days, rest assured I will get back to you a few days later. So thank you once again for the opportunity, and I wish all of you, all the viewers, the audience, the very best in your careers as dentists. Thank you so much.
Thank you, sir. Requesting all of you, please the feedback form. I put it in the chat box of YouTube as well as Cisco WebEx. So do fill that. Thank you, sir, for today's session. I will be leaving the